Module 2, Gathering Information. Asking questions to gather information. Hello. In this video, we are focusing on building your ability to ask questions that elicit the information that you need. You need to be able to ask questions smoothly and with correct grammar. You need to use an intonation pattern that shows that you are asking a question, but that doesn't come across as if you are interrogating someone. As HCAs, we often need to ask questions, gather information from clients. We need to find out what their status is. How are you feeling today? How are you doing? Are you in any pain? Can you describe your pain? Did you take your medication? Have you finished eating? Can I ask you about your sleep? What's that been like recently? What about your appetite? How's your appetite been? We want to find out their preferences. Would you like to have your bath now? What would you prefer, the fish or the chicken? What would you like to wear today? Would you like to wear your white sweater or this flowered wrap? What can I do to make you feel comfortable? We may want to find out how they feel about the care they are receiving and how we can improve it.
Would you like your bath now?
I don't think so. Not today.
Is it just that this isn't a good time, or is it about baths in general?
No. Yes. I hate getting bathed here.
Do you want to tell me about it?
It's just so embarrassing. I hate having someone watching me. I need my privacy.
That lack of privacy is so hard. Do you have any suggestion about how we could make your bath time a better experience?
Not really. I just hate it.
Well, let's see. There are a couple of things we can do to make your bath time more private and still keep you safe. How about if I help you into the tub and then leave you there to soak in private in the warm water for 10 minutes? Then when I come back and help clean you up, how would you feel about that?
Sometimes we may need to gather very specific information that is required for some reason. For instance, to complete a form. Completing a form. Could you say your full name for me? How do you spell that? What's your date of birth? When were you born? What brings you in today? Has there been any swelling? Are you on any medications? What's it for? How much do you take? How often do you take it? Do you have any allergies? How do you react? Can you tell me about your medical history? Have you ever had a seizure, a stroke, blackouts, or blood clots? How about diabetes, depression, or high blood pressure? Any problems with your thyroid, kidney, or bladder? Any other health problems? Have you had any surgeries? When did that happen? Any medical problems in your family? Anything else? Let's talk about the types of questions that we could ask. Sometimes we could ask closed questions. Closed questions elicit very short answers. Often the answer is just a yes or a no. Would you like your bath now? Are you in any sharp pain? Is it a sharp pain? Closed questions offer a choice. Would you like the fish or the chicken for supper? Is the pain sharp or dull? Sometimes closed questions sound like open questions, with a who, what, when, or how, but the answer they elicit is very short and predictable. That is, they don't really lead to sharing of thoughts, feelings, and experiences. What's your date of birth? How often do you take it? When did that happen? When should we use closed questions? We use them when we are looking for specific, precise information. We also use them to give limited choices to clients who may have difficulty making choices. For instance, it might be better to ask a dementia patient, "Would you like to wear your white sweater or this flowered wrap?" rather than, "What would you like to wear today?" Similarly, we use them when it might be too difficult for a client to answer an open-ended question. For instance, if a client is in a lot of pain, or if they have a speech disorder, you may choose to use a closed question, where they only have to nod or shake their head or point. Is it a sharp pain? However, closed questions are limiting and may keep us from finding out crucial information. Let's talk about open-ended questions. Open-ended questions require more than just a yes, no, or short answer. They generate longer responses. They invite the person you are talking to share their thoughts and feelings and talk about themselves. They communicate more interest in the client and the client's life, experiences, preferences, and ideas. They don't limit the client to one or to a few choices. What can I do to make you more comfortable? Can you describe your pain? Tell me about your concern. Sometimes questions that are grammatically closed questions can actually be open-ended. That is, they prompt the speaker to give a longer answer if they say yes. If you ask a patient, "Are you on any medications?" you may get a no answer. But if the answer is yes, most patients will respond with a list of medications they are on. If you ask, "Have you had any surgeries?" you might get a no answer. But if the answer is yes, it will likely be followed by an account of the surgeries the patient has had. If you ask, do you want to tell me about it?" you might get a no answer, but you are also inviting a longer yes answer if the patient does want to talk about it, whatever that may be. Often it works to start off with an open-ended question and then probe with closed questions. Let's end with a brief discussion about barriers to communication. Chapter 5 of Mosby's Canadian textbook for the support worker provides a summary of communication barriers that can make it difficult to gather and receive messages. Barriers to communication. Some of the barriers the text mentions are things we can't avoid. There may be loud noises and distracting events happening around us. Our clients may have hearing or speech disorders that interfere with communication. However, many barriers to communication are rooted in how we communicate. That is, our communication behaviors can raise barriers. Here are some suggestions for lowering those barriers. Avoid interrupting. Interrupting is jumping in and speaking when the client is still speaking. We interrupt when we are bored, when we are not interested in the client. We interrupt when we're in a rush and impatient and the patient is speaking slowly. Often we interrupt when we are focused on the task, completing a form, and not the person we are talking to. Avoid answering your own questions. Again, we often do this when we are in a rush. Answering your own questions discourages openness, and we can miss key information when patients simply agree with our answers rather than explaining what is actually the case. How is your pain? All better, hey? You look like you're feeling great. Client: Oh, yes, I'm fine. How is your pain today? Client: Well, it is better than yesterday for sure, but I still feel some pain when I put my full weight on my leg. Can you see the difference? Avoid pretending to listen. It is often very obvious to the client when we are just pretending to listen, or when we are not listening. This communicates a lack of interest and care. Also, you may miss key complaints and crucial information that should be recorded and passed on to others. The next few activities will help you become more fluent as you ask questions to gather information.